The Bahamas today confirmed its first case of COVID-19 here in New Providence.
The confirmation of the country's first case of COVID-19 came in at midnight today, but Acting Health Minister Jeffrey Lloyd said officials aren't sure how the patient was exposed to the virus or who she has come into contact with since then.
The patient is a 61-year-old female resident of New Providence who does not have a relevant travel history. She presented with symptoms of fever and cough. She is not known to have traveled outside of the country in the past 20 days. And at this time, the patient's exposure is unknown.
Lloyd said the patient is receiving care at a designated area at PMH. She presented to PMH late on Friday with a fever and influenza-like symptoms. Officials said she was isolated immediately. Lloyd confirmed that health officials are investigating the patient's family and social contacts to determine if they could have been the source of her infection.
Steps are now being taken to respond to this public health threat. These measures include aggressive and extensive contact tracing, recommendations to the community efforts to mitigate transmission, and it is crucial that we understand now that to prevent further transmission depends on what we all must do individually and collectively.
Chief Medical Officer Dr. Pearl McMillan said the Ministry of Health is early in its investigation.
The family will be a part of our contact tracing investigation. As required, we would go ahead and do necessary testing.
And as the investigation into the patient's family progresses, health officials are urging members of the public not to panic and flood the hospital. Dr. Nakia Forbes explained that people should initially isolate themselves at home if they experience flu-like symptoms.
If you go to a busy doctor's office or a community clinic or the emergency room, which is currently under renovations at the Princess Margaret Hospital, and sit in the room, if you have COVID, you're highly likely to infect other persons, which will cause additional exponential spread. Please call your doctor's office ahead of time so that the doctor can prepare for your arrival.
Dr. McMillan said the Ministry of Health's COVID-19 plan is evolving. She said her team is seeking to put together a surge capacity plan to manage a large number of cases. In the meantime, she cautioned residents to take precautions.
Social distancing, not going to large gatherings, and if you are actually considering large gatherings, you really need to reconsider actually having those gatherings now.
The Ministry of Health has 100 test kits, but Dr. McMillan said they are hoping to secure additional kits. Over the last few days, residents have cleared grocery store shelves of cleaning agents, hand sanitizers, and bleach. There are more than 150 cases of the virus across the globe. Nearly 6,000 people have died, with the majority of deaths in mainland China. For the Guardian News Network, I'm Kyle Joaquin.